let's say we decided to do a treatment plan that we would either use as a report of findings for Harvey Lillard with him or with his family, or if he had insurance, we could send it to the insurance company, basically explaining how many visits we thought we were going to need, the therapies we were going to perform, etc. So obviously by now we would click on treatment plan. Now Harvey comes up again, and we have two options here. We can select Harvey and go screen by screen putting information in, or we can click on use template. Now, if we've created something that's for sacroiliac, and I made one here that's a sacroiliac dysfunction, by selecting it and hitting select template, it generates the entire template. And for the uneducated in EZNotes, it looks like this guy must have dictated, for 20 minutes, this entire information. But it pops up a 1 or 2 page document simply by doing that. So that would be the quick way of doing it using the templates. But let's say we want to do it, in this case, by the screen by screen. So I click on select template. I go to select. It's going to ask me a series of questions. First, what stage of care is he in? I'm going to say symptomatic. How many visits do we think we need? Whatever you normally work on. Let's say 12. How often, this is about for a month, how often are you going to be seeing him, the visit-wise? Well, let's say 3 times a week for 4 weeks. It's got the diagnosis code, so I can save them. Then it's going to say, what kind of adjustments would I be doing? I'm a diversified adjuster, so I would hit diversified. If I wanted to say SOT, I could pick that as well. You're just going to pick what you do. What modalities? Let's say I wanted to do ultrasound, and I wanted to do it over the right SI for 8 minutes. I would just pick each of the different modalities that I'm doing and indicate that. Then I might say, am I going to do any exercises? In this case, maybe we just talk about stretching exercises for the hamstrings, or maybe some core strength on body ball or stability ball work. I can put that in. Do I want to do any re-education? Maybe some PNF stretching. Do I want to do any therapeutic activities? I probably wouldn't, so I would say no. Acupuncture? I'll say no again. Activities of daily living? Sure. We could talk about anything from icing to pillows, etc. Anything he should avoid. And there's a series of things he might want to avoid. Perhaps we don't want prolonged standing, excessive sitting, any activities that aggravate, things like that. And then we can choose goals. Now, goals can be anything that's appropriate. If we've done the Neck Disability Index or the Oswestry, we can come up with very specific goals. Perhaps I just want to do some strengthening, and we can say to the low back, the lumbar spine. Perhaps I want to do anything dealing with increasing range of motion. I can pop that in there. We can say 30%, obviously it's nutation. It's not going to work particularly well in that area. I can decrease discomfort. Again, 30% seems to be what Medicare likes to have. And then I can say done. And then we'll have our note as well. So if you do it screen by screen, it just guides you through what you normally do. But if you normally do the same thing, we tend to work on about 38 different conditions as chiropractors, then you can build as many of those as you want. Again, I will help you with that. When it's done, you can exit it, you can print it, and you're ready to go.